Early onset versus late onset neonatal sepsis. Yes, we are all aware that is less than 72 hours and more than 72 hours. That is the discretion. So, early onset sepsis can be symptomatic at birth, and usually early onset sepsis is pneumonia, manifests as respiratory distress, right? So, usually early onset sepsis is pneumonia manifesting as respiratory distress, and most commonly source of infection is from the maternal genital tract. So, that's why they have manifestations within the first 72 hours. So, we will be saying now what are the risk factors for early onset neonatal sepsis, and then I will tell you what are the risk factors for late onset sepsis as well. Right. So, first for early onset neonatal sepsis, as we have just seen, the source of infection is from the maternal genital tract. So, a spontaneous preterm labor with or without premature rupture of membrane is the first common or the significant risk factor. So, the onset of a preterm labor. Then there is a rupture of membrane and there is a foul smelling liquor which is mentioned by the mother. The rupture of membranes which are prolonged more than 24 hours, that is a risk factor for early onset sepsis. And if the obstetrician colleague has told you that there is some infection in the mother, intrauterine infection in the mother, so foul smelling liquor, maternal fever, maternal blood investigations are showing high CRP levels, high WBCs. If there is a suspected or if there is a confirmed maternal or intrauterine infection, that is a risk factor for the baby. And a single unclean vaginal examination during labor, very, very importantly. So, all these are now coming down, but still in many rural areas, unclean, without wearing gloves, vaginal examinations are still done, not by the medical professionals, but by the other paramedics, etc. So, one needs to be very aware. If you are working in such a setup, please be very, very careful. And lastly, prolonged labor as such. So, prolonged labor in the sense the first and second stage of labor, which is more than 24 hours. So, all these are risk factors for early onset neonatal sepsis. Any of these one risk factor is present, it is also significant. And lastly, severe perinatal asphyxia, that is Apgar score less than 4 at 1 minute. Why so? Because a severe asphyxia will need resuscitative efforts. The baby would have been started on oxygen, maybe the baby had required endotracheal intubation or UVC, we don't know. So, an Apgar score less than 4 at 1 minute is also a risk factor for early onset neonatal sepsis. Next, we will move on to late onset sepsis. Late onset sepsis is the sepsis onset is after 72 hours of life. Early onset sepsis, the source was mostly from where? From the maternal genital tract, whereas late onset sepsis, it is exposed to the healthcare system, isn't it? So, it is mostly a healthcare associated infection, or if the baby was discharged on day 2 or day 3 and the baby comes back by day 6, day 7 telling the baby has a fever or lethargy or feed refusal baby, when you suspect sepsis, it is most often a community acquired infection. So, it can be either a healthcare associated or a hospital associated, or it could be a community acquired infection. Now, you should not think of this maternal genital tract. Late onset sepsis is mostly these two. Early onset sepsis was most often a pneumonia, whereas late onset sepsis can be septicemia, it can be meningitis, and it can be pneumonia. So, meningitis is mostly seen in late onset sepsis, not in early onset neonatal sepsis. So, next we will think about what are the risk factors for late onset neonatal sepsis. Early I told you it is all dependent on the maternal genital tract. So, premature rupture of membranes, prolonged labor and maternal fever, maternal inflammation, there was one unclean vaginal examination done, etc. So, risk factors for late onset neonatal sepsis will be those babies who are at high risk, who are like premature or lower birth weight babies who are predisposed to infections, babies who had mechanical ventilations, who had invasive lines, who had parenteral fluids, and once they are discharged from the community, they can acquire infections like if there is very poor hygiene practiced by the family members, poor cord care, especially in the umbilical cord, application of cow dung, application of salt, application of whatnot, this herbal powders, etc. for drying up. So, all these cord practices, very unhygienic cord practices, etc. and bottle feeding, giving of pre-lacteals, giving of anything other than mother's own milk. So, all these are risk factors for late onset neonatal sepsis, right? So, you have to remember the early onset sepsis versus late onset sepsis. This is pneumonia, this is most often septicemia and meningitis, and the risk factors for both.